My name is Chitra Viswanathan, and I am MD Anderson. I am an assistant professor in the Division of Diagnostic Imaging. I work in both the chest and the body section. I read all sorts of x-rays, CTs, MRIs, basically encompassing from your neck down until about your pelvis. I don't think many people know, but my mom was a patient here at MD Anderson for a long time. So I think from her I always learned, and from our experience as a family, is that the patient comes first. It's always important to take care of the interests of the patients and their families. It can be a very difficult experience here at MD Anderson, and I think the doctors here and the employees here do a great job of making it a less painful experience and making it one of hope and experience, of long-term experience, of very caring, and they're very dedicated. My mother's physician and surgeon was very dedicated to her. So I think for her, I always keep in my mind that that is my motto, is to serve the patient first, and then I think we're also important to serve each other. We're all here together to do a good job, and there are a lot of things that we can't navigate alone. And I think that's where it really helps. I've had a lot of good mentors in my career, and also not just other radiologists, but people that I've met across the institution that have provided me that experience and that knowledge. So I try to give that back to them too as well. I think one of them is to always be open and honest. I think people really appreciate honesty, even though sometimes it may be a little bit painful or it may be difficult to hear. I think honesty is the best way. And I think also it's true for me with people with disabilities. I know a lot of people might be scared of me as, being in a wheelchair, you don't know how to approach or what has happened or anything else. But I've always found that the people that have been the most honest with me and kind of used my sense of humor or a sense of humor to kind of deal with it have always been, it's just gone past it and we just move on it. One of my bosses in chest imaging is so kind to me, and he always helps me push forward my cause. A lot of times I didn't really have a voice earlier on, and I was afraid to ask for what I wanted. And so he would say, hey man, this door's kind of hard for you to open, it's hard for me to open, can we do something about the door? And so he arranged for an automatic opener to be put on the door, which I thought was very nice. So I think, approaching those things and asking for what you want, I think is always very important.